Good evening, everyone, and welcome to the New Teeth Now webinar. My name is Bianca, and I'm here tonight with Dr. Kirkpatrick. Hello.
Hey, Bianca.
And we are so glad to have you joining us tonight. We're going to be talking all things full mouth dental implants and the New Teeth Now procedure. So we're so excited that you're here, and we are ready to answer your questions. So in YouTube, there should be a chat box on the lower part of the screen that you can, on your phone or on your computer, however you're watching us, you can type any question. We can see that and we'll be able to answer that for you tonight. So we're excited to answer really anything. So go ahead and start submitting them. And then as we move through the slides, we'll remind you to submit them then as well. But we're going to go ahead and just jump right into it and get things started. So how are you doing today?
I'm doing good. It's been a busy couple of weeks, but been really good weeks.
Good.
So we've seen a lot of patients and got to do a lot of cool procedures, long days, but very good results, and
Change some lives.
Absolutely.
That's awesome.
Cool transformations.
Awesome.
Well, we will jump right in. So the webinar tonight, we are going to be talking about a lot of different implant concepts of how we can replace pretty much everything in one jaw or both jaws with implants and implant secured bridges. That they're not a true replacement for your natural teeth, but they are very, very close. And it's the closest thing that anyone has to replacing your natural teeth. So we will jump right in. All right, so a little bit about me. I'm originally from Kentucky, did all my school at the University of Kentucky, and did surgery at the University of Florida in Jacksonville. And one of the most important things that you will hear tonight, or that I hope you're paying attention to, is that I am a board certified oral maxillofacial surgeon, as are my other partners here with us at New Teeth Now. And that is very important when you're considering who's going to be actually having their hands in your mouth and treating you and doing any type of procedure on you, to whether it's removing teeth, placing implants, all the above. You want to make sure that they're board certified, and we do recommend that it be an oral maxillofacial surgeon. So here are our surgeons that I work with pretty much day to day. Dr. Richards, Dr. Vorwald, Dr. Nunez, and Dr. Sharafi, and we are kind of spread out in multiple different areas across the country. We are primarily based, our home base is here in Lakeland, Florida. Dr. Sharafi is out in San Diego, California, and we're super excited about him being part of the team. He's an excellent oral maxillofacial surgeon, and he's getting to serve patients who need this type of procedure on the West Coast. And then we also have the Villages, Florida, which is a very unique little community, just kind of about an hour and a half north of where we're at here in Lakeland. And we've got Dr. Nunez there serving that population. So along with being board certified, there's a couple other things that you really want to know about our New Teeth Now practice. And it's a lot of these give us the ability to treat a lot of patients that otherwise just would not have the opportunity to be treated, because either they don't have enough bone, or maybe they just can't undergo the procedure under local anesthesia, which I would never recommend anyone doing, or just from medical situations, it's nice to have an anesthesia team that can provide a true general anesthetic where you're totally asleep. That way you come in, you go to sleep, you wake up, the surgery is completely finished. So at the end of the day, we're ready to put the teeth in, and you basically just slept through the entire time that I've been doing my thing and working. So this is how we do that. So when we're replacing everything in one jaw, this is showing the upper, which is called the maxilla, that's your upper jaw. And typically we would place 6 implants, which is what we consider gold standard to replace all the teeth on the upper. And you can see how they're kind of ghosted in this picture. So those curly Q looking screws, they're the implants, and then the bridge gets screwed into the implants. So it's fixed, it can't come in and out, you can't take it out. You treat these, the concept is to be able to treat them just like teeth. So you brush them, toothbrush, toothpaste. You come in and get a cleaning every 6 months, just like we do with our natural teeth. So we try to make them to where, they're very functional, they're very aesthetic, they look good, This is showing kind of the same situation with the lower jaw, but it does kind of show those little posts sticking up out of the implants, and those are what gets connected to the bridge. And it just kind of secures it where it's super stable. Unlike a denture or a partial, there's nothing there that can move. So patients truly can, once these things have healed, you can eat what you want. So it really takes it back to just getting you to a daily routine where you don't have to think about your teeth. If you have bad teeth, or you're missing all your teeth, or missing most of the teeth and the rest of them need to come out, there's very, very good alternatives like this over a denture or some type of partial.
Yes, and we actually had a question come in already.
Oh, perfect.
About general anesthesia, which is perfect. So
Okay.
how can general anesthesia be safe for patients that have cardiac or lung issues? Doesn't it slow down heart and lung functions?
So that's a really good question, and the answer to that is actually opposite of what you're thinking. So when a patient comes in and undergoes this procedure under IV sedation, there's a lot more stress on your body because you're playing with a little fine line of giving drugs, not giving drugs, giving drugs, not giving drugs, to keep patients at that, that perfect little spot where they're comfortable, but they're not too deep. Because if you get them too deep and it's IV sedation, then that does play a role with your heart rate, your blood pressure dropping, and more importantly, your airway. So if you were given too much medication during an IV sedation, you could actually stop breathing. So we got to stop what we're doing, jaw thrust, chin lift, jaw thrust, and try to stimulate you to, hey, like Mr. Kirkpatrick, take a breath, and you're playing with that the entire time. And when we're doing this procedure, especially with the implants, you want to keep them cool, you want to keep everything rinsed off and clean. So we use a lot of irrigation. And if you're under IV sedation, that can be a really scary time because we're trying to keep everything cool, we're trying to keep everything rinsed off, and especially using water when we're using anytime we're using a drill. And some of that saline, which we're using for irrigation, if it drips down the back of your throat and you've kind of lost some of your reflexes to be able to cough, that can go down, tickle the vocal cords, and they slam shut. And then you can't breathe. And now we're in what could be an emergency situation. So with the general anesthesia, we have a separate anesthesia team watching you while I'm doing the surgery, or Dr. Richards or one of the other surgeons. We're concentrating on the surgical procedure. They're totally focused on keeping you safe, keeping you under general anesthesia. You have a breathing tube with general anesthesia, which you can't with IV sedation, which that protects your airway. So I can use as much irrigation as I need, whatever I need to keep you everything rinsed off and clean, cool with the implants, cool with the drill, and that's the best way we can get the best outcome for you.
That's
and
a
it's
great
safe.
question.
So not only,
Yeah.
as far as when we can keep you under general anesthesia and super comfortable, then we are controlling your heart rate, your blood pressure, and we can, instead of trying to really keep you comfortable, and you get too much weight during the IV sedation, your blood pressure goes really high. Then we slam you with medications, and trust me, I've done that in the past, and I would never ever do that again with a patient because general anesthesia is such a better way to do it. Patients like it more. You're way more comfortable. I mean, you're truly asleep just like any other outpatient surgical procedure. And you still go home at the end of the day. But we've got you monitored, and we feel the safest way possible to do this procedure. But great question. And we do, like Bianca said, we love the questions coming in. And a lot of times, the questions and the answers that we can give you make the webinar more so than the pictures and a lot of the implant stuff that I can talk about. So definitely, if you have a question, submit it and we'll answer
We did get
them.
another one in,
That's
which is
great.
perfect. What is considered as not having enough bone to be able to get implants?
So another good question. It's very difficult to say, if someone is really, truly not going to have enough bone to place implants. I mean, I've been here since the middle of 2007, and I've yet to see a patient for a consult that did not have enough bone to do the procedure. So in the upper jaw, zygomatic implants really, really help us. And that's usually the kind of the big area that a lot of people would get turned away from other places because it's hard. You know, you can do sinus lifts, you can do bone grafts, but if you truly have like paper thin bone, then sometimes it's very difficult to be able to graft enough bone that your body accepts and takes, and it hardens enough to do regular implants. And the zygomatic implants, they've kind of been a really blessing for us to be able to use on patients who do not have enough bone in the upper, and we anchor them into the lower part of the cheekbone. And we can put up to 4 or more zygomatic implants in the upper jaw. And you know, it's something we do a lot of, and I think it's just because we've kind of got that reputation that, you know, hey, if you don't have enough bone, there's some people in Lakeland, Florida that really do this a lot. And you know, last week I did 3 of those cases where I did quad zygomatic implants.
Wow.
And those are patients that ultimately, if they were somewhere else, and they were, I think I was their 3rd and 4th opinion with one patient, who they just came in as a last resort. Like, look, you said on one of your webinars and commercials that you've never seen a patient that did not have enough bone to do this procedure. And so I'm here to get told no one more time.
That's really cool.
And you know, I saw them for the consult, look at their scan, and we planned it, did it, and they had a very successful procedure.
Awesome.
Yeah. All right. Any others?
No, that's good. And it's perfect because we're going to talk a little bit about zygomatics.
Here we go. It's the next slide. So the zygomatic implants, these they do look a little different than what these are showing, but it is a pretty good representation. Just showing they look like a regular implant, and they are. It's the same thing as a traditional implant. They're just longer, and they're anchored into a different spot, a different bone. So we bypass where patients do not have enough bone in the upper jaw, anchor them into the lower part of the cheekbone. And this little video kind of shows 4 traditional implants, kind of in the very front and the middle, and then these zygomatic implants in the back. They give a very strong foundation, and then you can see the bridge gets screwed in with these small titanium screws to the implants, and that is a totally stable, fixed, non-removable bridge that you treat like natural teeth.
Yes.
Yeah. So it's a very, very cool thing to be able to offer patients who otherwise would be stuck with a denture or just staying as they are, however that is. So this patient, you know, that's young lady that she is pretty much exactly what we talk about. She had a failing bridge on the top. That's one big roundhouse bridge on 4 or 5 natural teeth remaining. The bridge was failing. You could literally take it in your fingers and move it up and down. And she lives in the northeastern United States, and she'd been to several other people for consults. And she was told that, you know, you really don't have enough bone in the back part and all the areas of your upper jaw for implants. And it would take significant bone grafting. They didn't give her a really good prognosis if she did those bone grafts. So she called us, set up an appointment, and we kind of coordinated everything. And we do that a lot with our out-of-state patients to try to make it as easy as possible to come down and see one of us for a consult, surgery, recovery, go home with your teeth. And she did that. So she came in, that's her before, that is her after, and you can see beautiful smile. You know, and patients get to pick out, really have a big opinion of your size, shape, color of the teeth, and I think they look beautiful. She wanted big, white, pearly white teeth. And we did that, and you can see on this picture of her post-op x-ray, she's got 4 traditional implants, and then she's got 2 zygomatic implants, 1 on each side in the back. And they're supporting the molar area, which is a very, very important spot to have good support on these bridges. You know, those molars, they're the ones that are really kind of taking the brunt force of the vertical chewing. So when you're trying to mash foods in the back, You want good support there. And without zygomatic implants, she either could not do the procedure, she needed a denture, or she'd have a really short bridge just on those 4 implants and pretty much be limited to eat like a rabbit, just with the front teeth. Which can really, and she told me that, and I've had other patients tell me that they've had dentists that actually told them that, hey, you really don't have enough bone to put implants in the back. But don't worry, they'll look good when you smile. It won't fully fill out your smile, but you'll have teeth in the front. They'll look good, and you'll adapt and you'll learn to eat like a rabbit with your front teeth. And I kind of laughed at that, and the patient said, no, there was a dentist told me that. And so that is, that we kind of joke around about that with some patients, but it's a really long term, how you chew food and your muscles and mastication work, that can affect your TMJ joints, which can long term have a bad effect on those, and also your digestive system, because you can't really chew your foods properly. So if you end up swallowing foods not chewed fully, and then you expect your stomach to start the digestive process, and that usually causes delayed gastric emptying and all of this stuff where it's just long-term problems. So when it's something we can easily fix by adding the zygomatic implants and getting the support where we can extend the bridge back, and they last because they're supportive. So this is showing a patient who really has just no bone in the upper jaw, and we replaced all the teeth with the quad zygomatic implants. So you can see there's 4 zygomatic implants, 2 on each side. The 2 longer ones that are more toward the middle, they're actually coming 3-dimensionally out toward the front teeth to support the front, and then you've got the 2 in the back that are supporting the molars. And that ultimately gives, like a patient like this, the ability to have a screwed in fixed bridge, where otherwise, good luck with a denture and using denture glue for the rest of your life, because that's what they were doing.
We have a good question that just came in.
Okay.
What about not having enough bone on the bottom arch? What can be done in that case?
So usually the lower jaw, it's unique because it's a really hard, it's the only bone in the face that moves. So it's like one of the strongest bones in the face. And usually we can find enough bone to put traditional implants, even with significant bone loss. But if there's not, then there's a couple different procedures that we can do where the implants are just almost like they're made custom to wrap around the jaw and then screwed in like that with the support system coming up that the bridge would get screwed into that. So there's all kind of different ways that we can treat that. But 99.9% of the time, the lower jaw we can find enough bone to put traditional implants.
Awesome.
Yeah.
Good question.
It's almost always the upper that's more of a problem. So we have a couple of before and after pictures that we're going to show. And Rex, he's a unique patient. I love his story, and he actually was nice enough to offer to let all you guys in our marketing department do kind of like a testimonial, and he kind of shares his story, that what he was going through before he met us, during his time with us here, and then after, how it's affected him. So we'll show a little video that let Rex tell his story.
Travel shouldn't be an excuse not to do this. For the benefit you're going to gain, it's worth it. It really is. I work for an oil company in the U.S. We have an oil field in the Sahara Desert, and I'm the manager of the entire project. I'm from Louisiana, and when I'm not home on the farm, I'm here in the desert. I have video conferences with people from all over Europe, Africa, of course, and even in Asia. So appearance for me was, that was a big worrying aspect of my teeth. Probably the last 4 or 5 years, I've noticed that my teeth were getting a bit brittle. I'll have, chip off or a crack, and that gets to be very painful. I knew that I had to do something. I found new teeth now on the internet, and it was like a ton of information. Just I couldn't believe that they were actually doing this. This is what I was hoping I would find. And the more I researched New Teeth Now, and the more I dug into the webinars, the patient testimonials, and all of the process, I was sold. And I made the phone call and set up a consultation. And when I went in and talked to Dr. Kirkpatrick, it just sealed the deal. Explained the whole procedure to me, what he was going to do, why they were doing it, and to get that first set of temporary teeth already made, so that the day of the surgery they'll be able to put them in, and it was that easy.
Wow. They're beautiful. It feels great. It really does. With the new teeth, I can be me, I can smile, I can be more personable. Thanks to New Teeth Now, I am more confident, more happy, and very satisfied. Now with the new teeth, I feel like I'm back to eating whatever I want, however I want, and with no holds barred. Because I know that they're secure, I don't have any worries about these coming off or breaking or any of that. Do the research and see if New Teeth Now would be a fit for you, because the work they're doing there is phenomenal. The new technology, the hands-on, the personable treatment that I got, bar none, it was great. So all in all, I have no regrets, none. It was worth every minute and every penny. It really was.
I love that before and after picture. And his story's cool because, working, literally that was the Sahara Desert in the background. And the first time I saw the video, it was kind of like, it looks like a large building, but it's
the desert.
Yeah, it's the desert, which is super cool.
So he's abroad and he still came here. We made it happen, and it worked out great.
It did, and he looks fantastic.
Yes.
And he has, more importantly, no infection in his mouth.
Yes.
And he can function and eat and just not really think about, gosh, when's my next tooth infection going to happen, or my next tooth break, and he's going to be over, and who knows where, and is there a dentist in the area? Could he find a dentist? Is it going to be somebody that could really help him?
Right, it's so true.
So now he can not really have to think about that. So it is cool, and I love being a part of that and kind of hearing his story and just getting to know, because we really do get to know a lot of our patients on more of a personal level, because they're telling us what they've been through and how much it would mean to them to have secured teeth and just a nice smile, out eating dinner with their friends, family. It is fun. It's very rewarding to be able to participate in that part of a patient's life. So
We did have a quick question.
yeah,
We have time? Yeah.
let's do it.
During Zygomatic implant procedure, does the TMJ get taken into account? For example, if there's already TMJ issues, can they be corrected? Anything like that?
Yes and no. So the Zygomatic implants, they don't really affect the TMJ more or less than any other implant. They truly just give us a different bone to be able to reach out and touch and get the teeth secured to when patients are missing a lot of bone. But in regards to TMJ problems, if a patient does have TMJ problems, there's a list of things that can cause those joint problems. Most of the time, I would say it would be more muscle related. And a lot of times, if it is muscle related, that's because of the bite. But it could be from stress. It could be from, a list of things. But if it's from the way the teeth meet, and that's one of the big reasons that orthodontists are around, and they straighten kids' teeth or even adults' teeth to try to create a more perfect bite, which creates some harmony in the mouth, which does help relax the jaw muscles. And that can affect and take some stress and pressure off the TMJs. If patients are having TMJ problems and it's from the occlusion or the way the teeth meet, then getting a full upper and lower bridge that have a really good relationship with each other and they have an even bite on each side, a lot of times that can stabilize the joints. But if it's from some other type of pathology, then it's not going to necessarily make it worse. It's not going to make it better. It's just things are going to probably stay status quo.
Good question.
Good question. That we've never been asked before.
I know, that's a great question.
That is a very good question. So who's a candidate for this procedure? So people who have obviously no teeth or unhappy with dentures, definitely are a candidate. Patients who have a mouthful of bad teeth, we see this more and more, and especially with younger patients who have just maybe neglected their teeth, maybe just had some bad day-to-day habits where, smoking, a lot of tobacco products, a lot of sugary, acidic drinks and foods. They can definitely deteriorate teeth over time, which can soften the teeth, and then that leads to a lot of breakage of the enamel, a lot of decay, a lot of teeth that need to be fixed, probably have been fixed. We see that a lot. Patients have a lot of dental work done in the past, and now that dental work is failing, so they're kind of stuck at like, gosh, I've got all this dental work that I've had done in the past, it's all failing. My dentist told me there's nothing really more that they could do, so they're looking at dentures, and a lot of these patients do not want anything removable. People who have severe periodontal disease, so like the infections around the gums, and then definitely patients who've been told, and we've kind of hit on this a lot tonight, but if you don't have enough bone for implants, just call the number. You come in for a consult. Consult is, it's just a little bit of your time. We get a CT scan and kind of go over that together. So you'll see exactly what I'm looking at, and you'll see, pretty much pinpoint where I would put these implants and how we could, get you a very good stabilization for a non-removable bridge. So back to the key differentiators. Obviously, you can see that I like this slide because we put it in here more than once because it's super important. Board certified oral surgeons, zygomatic implants, general anesthesia, not IV sedation. There's a huge, huge difference. And a lot of times we'll see patients, I know we talked about this earlier about the difference, is it safe for general anesthesia versus IV sedation? And a lot of times we'll see patients who come in for a consult and we're a second, third opinion, and they've been other places and they say, oh, well, they said they'd put me to sleep too. And then you start asking, and we're like, well, did they talk to you about the breathing tube, going through? No, they didn't mention that. Or they talked to you about a separate anesthesia team? No, they really didn't mention that. They said as more IV would go in, the medication would go through that. That's an IV sedation. That's not a general anesthetic. You can't be, safely asleep with an IV sedation. You can be kind of a very light sleep, but you're still arousable, and it's still very difficult to take away a pressure sensation. So when we're retracting the cheek out, I can numb you up, and we do that, but you still feel pressure. And a lot of times under IV sedation in the past, patients would, I'd pull their cheek out toward the left, and they're kind of like, and then you got to give them more drugs. And it's just a nightmare to do this for me and you as the patient. And that's why we choose to do this under general anesthesia. Try to make it as safe, as relaxing for you. And, and you've got it, that having that two-man team watching you where I'm focused on the surgery, they're focused on the anesthesia. It can't get any better than that.
Yeah.
So our implant coordinators, we've got Shauna, Allie, and Crystal. And now we have a new implant coordinator that we're very excited about, Chastity. She's not up here yet. But all of these young ladies, they really are super helpful to patients who are thinking about this, even with that first phone call. Usually when you're scheduling the appointment, you'll speak to one of these ladies and they kind of prep you about what to expect when you come in for the consult. And, they're very informative. Most of these ladies have been surgical assistants, so they've seen, the procedure, which is very helpful in answering some of the questions you may have. They're like, oh yeah, no, they can give you confidently answer your questions. And a lot of times I'll walk in for the consult and they've already spent 20, 30 minutes or more going over everything with you. And then I come in and I start going over the scan or talking about the procedure, and they're like, oh yeah, well, Shauna's already told me that. And I'm like, I mean, I want to be able to tell that. And I want to tell
They
you
know
that
everything,
exciting
right?
news. But it's very reassuring, because for you as a patient, you can have confidence in us at this office that you're going to get a very good procedure. And it lets me know that you as a patient, you're getting a ton of information. Because if you're hearing about it from the implant coordinators, and then I'm coming in and going over what I feel like is the really important part for you to get out of the consult, then you're going home with hopefully enough information that you can make a good decision that's the best decision for you to be treated.
Very true.
And then our restorative team, Dr. Nafala, Dr. Dibbs, Dr. Sorrento, each of these three guys have also been doing this for many years, very, very knowledgeable about the procedure. And they're a huge part of the team. I mean, it's not a, one-man show where surgeon kind of is doing everything. I mean, it really takes everybody, from the marketing team to the business side, to the implant coordinator, to the treatment coordinators, to the restorative team, the surgery, the anesthesia, the lab. I mean, everybody is super important. My surgical assistants that you're going to meet in a minute. It takes, there's always the quote, it truly takes a village to help raise a child. And it really does take the entire team, the entire village, to get patients to their goal of a nice, pretty smile that they can function and eat the things that they want to, and not really think about the teeth anymore. So Dr. Dibbs is going to talk about his experience being here with the entire team under one roof, and especially having the lab here that he can talk to about certain patients and how he's going to get them to their goal and their expectations, and I'll let him tell his story.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
All right. And then here, actually, let me back up. So my surgical staff, and it's kind of changed a little bit. Amanda is still with me. Zoe is now, and we get sad when we miss or when, somebody decides to move on, but we're also very happy and we want to, be able to educate and train someone. So if they do want to move on, we've had some assistants that have gone on to dental school, further their education, just a different line of work. Like Zoe is planning on doing, she wants to be an OR surgical assistant at the hospital. I think it's a bad decision. She should stay with me, but I'm very happy for her. But she's still with us and she's doing recovery. So if you come in soon, you'll still get to meet Zoe. But it's cool working with these young ladies because they truly care about our patients, and a lot of times, you'll get to know them really well because they're doing screw checks and a lot of these little quick appointments when you come in, and then I'll pop in to just make sure everything's looking okay, but they truly help get you through the recovery process.
Definitely.
And they definitely make my life easier, which is very important. So the process that we have here is, your initial visit is for the consult. That's when you meet with me and one of the implant coordinators. You get a ton of information. Your next appointment, if you decided to move forward with this procedure, is for a pre-op and impressions appointment. So you come in, they kind of go over all the last minute details. We scan your upper and lower jaws or get impressions, and that's what we use. And you pick out your teeth, what you want them to ideally look like. So it's a fun appointment. And then it takes, a few days to make those temporary teeth, which I use in surgery. Then you come in for your new teeth nail surgery. I use those temporary teeth as a guide to help me angle the implants in the most ideal position for you. Everything is customized for each different patient. We don't have a stock of like small, medium, large. Everything is truly customized for every patient. And then any post-op appointments and adjustments after those temporary teeth are placed the same day. And then we put in the final teeth that usually take place somewhere around the 5-6 month mark. And then after that, it's just care and maintenance. Toothbrush, toothpaste. Every 6 months you come in for your cleanings. And those are very, very important appointments. This is not a procedure that if you are planning on doing this and never coming back to us or a general dentist, you probably shouldn't do this. This is something that you're going to invest time, money, you want to take care of them, and you can very easily do that. The maintenance appointments when you come in, they're very short, very quick, very easy. There's no needles. We go in, we unscrew the teeth that, super quick and easy, take them out, make sure your gums look good, make sure there's nothing trapped in between the bridge and the gums. Put your bridges in an ultrasonic cleaner, we disinfect them, polish them, put them back in. So, and Dr. Nafala, he has a really cool analogy that I loved it when I first heard him tell a patient this, but he's like, essentially like, you wash your teeth every day, just like you do your car. You wash your car every so often, and then a couple times a year, you take it in to get it professionally detailed. That's what we're doing with your bridge. So these things, they don't really stain bad and not as bad as your natural teeth, but they can pick up some stains. So if you're a heavy coffee drinker, tea drinker, smoker, which we'll talk about that and try to encourage you to stop smoking, but they do pick up very minor stains. But when you come in for your cleanings, we steam clean them and it takes them back to their new
It's like getting
look.
them whitened again.
It is.
Back to normal,
It's
yeah.
super cool. And it's one of those things that I would look forward to, and knowing what I know about this procedure, if I ever needed this. I mean, I would go
And it's
straight.
painless, it's quick, it's not like going to the regular dentist. So
No,
it's,
not at all.
It's worth doing.
And I would go around, they know anyone here in the office. If you ask my opinion, hey, what color do you think, Dr. Kirkpatrick? Hollywood white. There's not another color. It's one of those things where just to get that really bright, pretty smile. And then we can keep it like that. You know, we can help you maintain it and keep it that big, bright, illustrious smile. So we have a lot of resources, and I think, did I skip one?
No.
Oh. And I'll let you talk about some of these from a marketing standpoint and an educational standpoint for our patients.
Perfect. So if you want to learn more, we are on all the social media channels. So you can find us on Facebook, on Instagram, and see before and after photos of our patients. You're already on YouTube, so you can always stick around and watch more webinars, watch more testimonial videos. We have lots of great content on YouTube as well. So definitely follow us online. You can always message us on our social platforms too, and we respond and answer questions. So feel free to contact us through there. And we also have our New Teeth Now community page, which is on Facebook. So you can search for that. It's a group that you can join. You can ask questions and talk with patients that have had the procedure before. So we have a lot of patients giving advice and just sharing their stories and sharing their photos and their whole experience. And it's really a great resource of finding community of people in similar situations of you, and what they've done, and the before and afters there as well are incredible. We're just happy that you joined us tonight, and like we said before, please give us a call, ask us more questions. We'll hear, talk about your unique situation, and we'd love to see you in for a consultation. But thanks so much for joining us tonight. Thank you for taking the time to be here.
Thank you for helping host this.
Yeah, and we hope that everyone has a wonderful evening. So good night, guys.
Yeah.